11 o'clock, and I met with her at 10, and she came in late.
And Commissioner Solomon is known for being early. I just can't get all excited about this, except that I would hope that on the following Wednesday, there might be some discussion by the commissioner what went on in that meeting so that we are kept appraised of it. I think they deserve a lot of credit for the work they've done to make these meetings far more open than the secret society it was 5 years ago.
Thank you, Mr. Babson. Mr. Albee?
I have to agree with David that, or Mr. Babson, that it's a big business, you need time to operate. What used to happen was that you, and it's perfectly legal for all three of you to be in the same room with someone and discuss something. The law regards decision-making. You need to be able to have advice about things, you need to be able to get information about different parts of the county government and whatever it is you're trying to purchase or construct or whatever. But any sort of discussion that would regard decision-making, actually deciding what you were going to do, needs to be in public. And I think that
No decisions were made.
That generally is the case. So I'm sort of in agreement with David that I'm not certain that actually constituted a meeting simply because you're all in the same room. That said, was this going to be a non-public with the landscape architect? Is that what
It was not posted as a public or non-public. She requested to meet with me, and I set the date at 10 o'clock.
I remember that we had a conference call and we spoke with her, and she was not coming on non-public. She was going to send in numbers. And I think anytime there is a meeting, even if one or two commissioners cannot make it or whatever, I think you should notify the commissioners by email or give them a phone call and say, hey, I'm meeting with a landscaper at 10 o'clock. They should be notified, even if it is that busy.
Okay. Any further public input? Yes, Mr. Babson.
Last night I went on the webpage to try to get today's minutes. And could somebody please explain to me what I'm doing wrong? I went to the website, I went to minutes, I went to commissioners, and it pops up and says we can't display this webpage.
You have to hit the other, it says try another, way to get in. And, because that happens.
And what would that be, standard for the back of the computer or what?
No. There's a list of things, and it will say try another site. So if you push that, it will bring you to the minutes.
Oh, okay. You mean when it pops up and
Yep,
says
yep.
you can't
get
display
into
this, try another website?
That's
Okay.
how I
You
did
just
it.
click on that and it works?
Yep, I think it's a blue, it's a blue heading, if I'm not mistaken.
Okay, well, that answers that. I can do that, but after 4 or 5 years of working on this webpage, why can't we click minutes and get minutes?
I don't know. I don't go on there to get the minutes. Yes, you got an answer. Go ahead.
I think I have one. When it pops up like that, what it is the frame. From what I've been told by the developer that developed that page, the frame may not fit the size of the document, so it says to pop up in a different window. When you push that, it will bring you. It should bring you.
Just come here on Wednesday and get them in paper. What's wrong with you?
I believe this whole problem will be solved once we go to our new website. So let's just hang in there for another few weeks and see if we can overcome the problem.
All right.
Thank you.
Further input from the public? Anybody? Okay, if not, then we'll move into our regular board meeting. And would you introduce yourself and why you're here, please?
Good morning. I'm Mickey McIver. I'm representing the Carroll County Regional Coordinating Council. I'm an employee of Coordinated Transportation Solutions out of Connecticut. We have been chosen as the mobility manager for the Carroll County RCC development, and I have handouts if you would.
Okay. We'll get back to the minutes.
see. Let me start this
This is there's a lot of pages, but I'll try to summarize them. Page 1, you'll notice, is just acronyms. The RCC development process has been ongoing in this state for,
Excuse me, Mr.
Yeah.
Point of order, Mr.
Yes.
Chairman, is there a possibility the public could get a copy of this?
I have a couple of extra copies, but I'm afraid I don't have enough for everybody. I didn't know who to expect. And these can be distributed, electronic copies, if anybody would care for one, just give me an email, and I will make sure that they're made available to you. Unfortunately, I didn't bring enough, I didn't know how many people would expect. The RCC process, development process, has been ongoing for nearly 10 years now in the state. It's an effort to improve the public transportation network, to improve the access to medical care and life activities for residents of New Hampshire. The initial effort actually goes back to 93 to 95, when the Commissioners of Health and Human Services and the DOT signed an agreement to cooperate jointly in developing transit. And for a number of political reasons, that initial contract agreement between the departments was set aside. In 2001, 2002, there were a number of meetings around the state. The initial efforts were centered in Concord, where I was the transit director at the time. And discussions started up again about how to develop a better, more cohesive network that pulled our volunteer networks, our neighbor-to-neighbor programs, our RSVPs, the many other entities around the state and the region that provide service to citizens, particularly to medical care, but also for other activities such as shopping, church, things like that. So the state created the State Coordinating Council in around 2004. They were charged with the responsibility of determining logical borders, if you will, for community regions, which would focus specifically on that region's needs for transit. And Carroll County, for a number of reasons, did not follow through in creating a regional coordinating council back in 2006, 2007,
And who was
2008.
supposed to do that?
It was an ongoing effort among a number of both public and private citizens, transportation providers, government officials from both the DOT and HHS. Carroll County got involved in a contract issue with the DOT with regards to the creation of a fixed route service for Carroll County. And some of you may or may not be aware of it, but it ended up, and still is, trying to be resolved by the DOT. Carroll County and the participants in that initial effort determined that it was in the best interests to resolve the fixed route issue as a linchpin to development of better transit for the whole region, resolve the fixed route system issue first, and then try to proceed back to the RCC issue. The State Coordinating Council created 10 regions. Carroll County is Region 2, and there is a map in the handout that identifies what those regions are and the essential borders. Now, where the other 9 regions had already been identified, C, created the formal infrastructure and the network necessary to begin to move forward with development of new systems, Carroll County had not. So the North Country Council, in an effort to jumpstart the program, to get them into the fold, if you will, with the RCC, to become identified as an RCC, obtained a small grant from the DOT to hire a mobility manager. Because Carroll County and the Region 2 is pretty much evenly divided between North Country Council and the Lakes Region Planning Commissions, the 2 commissions together partnered on the grant and did the review. There was an RFP put out to hire and identify a qualified mobility manager, and CTS, Coordinated Transportation Solutions, was awarded that contract in December of 2010. So it was a lengthy process, but we were fortunate enough to get the job. I'm a resident of Danbury, New Hampshire, and have been a transit manager here for 12 years and now working for CTS.
Who funds the organization? Is it the government, federal government, state?
Funding of the RCC itself?
Yeah.
The RCC itself is a completely volunteer organization of community members.
But you got a grant.
The grant came from the DOT
For what purpose?
for the purpose of hiring a mobility manager to help becomes recognized by the State Coordinating Council as a recognized state entity to develop improved transportation. And the authority for that is all explained in the handout as well. CTS, as I said, was chosen as a mobility manager. We are a Connecticut-based 501c3 nonprofit, not-for-profit, founded in 1997. We currently provide over 1 million trips per year. We have 400,000 plus Medicaid-eligible recipients under our charge to provide transportation for. We do non-emergency medical transportation in Massachusetts, Connecticut, and New York, and we do consulting services throughout New England. So that's who we are, and that's the essential information that we put into the response to the RFP. Because the State Coordinating Council was identified and created by legislation, one of the stumbling blocks that many of the regions, including some of the Carroll County participants back in 2007, 2008 had, was that the RCCs themselves were not identified by legislation as a legal entity of the state. And so, as you can see in the next page, Section 239B3 was passed in 2010, essentially giving state legal status to the RCCs to perform the work that they would be asked to do. And among them would be facilitate implementation of coordinated services, encourage development of improved networks, and advise the SEC on progress. So that gave us the legal standing to move forward and work more cohesively with an understanding at the state level that we are a state entity. As I said, the state was essentially carved into a number of regions. You'll notice, for those of you that have the copy, both Coas and Grafton counties are one region. That initially was set up as 2 regions. As the RCCs in those 2 regions got together and they talked about what resources were available, who provided what services to whom, those 2 regions determined collaboratively that it was in their best interests to become one, because they were so interlinked in their transportation network already. So they merged and they became the Grafton Coas Regional Coordinating Council. What is it? What are the benefits? Who should participate? And what will we be doing? We'll walk right through the process. As you can see from the graphic there, the current and existing conditions, every state agency, every agency that pays for transportation, whether it's the DOT, Health and Human Services, the veterans organizations, they all contract independently. So you have a number of different agencies funding a number of different local organizations that provide the service. So for example, a public transit entity can get money from HHS, DOT, anybody else that funds transportation. They can take private grants and contracts. And then those individual agencies fund the information down to a single source. Either they provide the service themselves or they hire somebody directly, so it's a one-on-one. But the confusion level lays between all the funders back to who do they contract with to provide what service, and understanding that mess. So the effort around coordination is to develop a centralized system where all of the funding agencies work through